Good morning. I'm going to talk about basic investigation, ophthalmoscopy. An ophthalmoscope allows the doctor to examine all the parts of the eye: the iris, lens, retina, and optic disc. For best results, the examination is done with dimmed or lowered lights to allow the pupil to maximally dilate or widen. A topical mydriatic solution may be applied to the eye to aid dilatation. The patient is then asked to fixate on a target for the duration of the test. Blood pressure. The pump, bulb, cuff, gauge, sphygmomanometer, the stethoscope, earpiece, headpiece, bell, and diaphragm. A stethoscope is used to hear the sound of the blood rushing back through the artery. The first thumping sound is the systolic blood pressure. When the thumping sound is not longer heard, that's the diastolic blood pressure. Taking blood. During venipuncture, the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa, that is easily accessible. She may apply a tourniquet above the side, or the patient may be asked to clench their hand to make a fist in order to make the vein more prominent. Afterwards, the patient may be asked to press lightly on a dressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and a hematoma where the vein was punctured. Thank you. Now I'm going to read the exercise. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expression she uses. Right, Mr. Gold, because you've been having these headaches. I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This while we're off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now, I like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me. Look at the clock. The number one, a couple of drops, is a topical mydriatic solution. The number two, which will make it easier for me to see the retina, is the to aid dilatation. The number three, I need to get rid of as much external light as possible. That means closing the blind. The examination is done with the mild lights. And the number four, look straight ahead at that clock, is fixate on a target. Complete distraction. Wrap the cuff around the patient's upper arm. Place the stethoscope over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Close the valve of the wall. Pump up the pressure to at least 150. Open so slowly a little and slowly deflate deflate the cuff while listening and watching the pressure systolic. The first sound you hear is the flow of blood through the brachial artery. The value of the gog at that point is the systolic blood pressure. Continue listening while you slowly deflate the cuff. The diastolic blood pressure is measured when the sound completely disappears. Complete the test. Phlebotomists are especially trained in taking blood. They are skilled at vein pressure puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a situable vein, the patient may be asked to make a fist or a gentle tap. May be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tube are labeled correctly before they send the hematology to the hematology laboratory, where a full blood count or other investigation will be carried. Thank you. Ahora voy a estar leyendo los ejercicios en español. Un doctor está hablando con un paciente durante una oftalmoscopía. Relaciona las expresiones subrayadas con las expresiones de significado similar. La primera, un par de gotas en sus ojos. Un par de gotas en sus ojos va con un colirio midriático, lo que facilita que pueda ver la retina. Va con, para ayudar a ver la retina. La tercera